morning. Thank you for being here. It is my great pleasure to introduce Professor Ioannidis, who will give the talk you have on the slide. What to say about Professor Ioannidis? Professor Ioannidis is formerly Professor of Medicine and then also Professor of Epidemiology, of Statistics, and Biomedical Data Analysis at Stanford in various Stanford departments and the Stanford Prevention Research Center. He's the person who created, I would say, the field of meta-research, so research about how research is done, covering everything from planning to reporting to rewards to how to organize the research ecosystem. And in an essay that he writes about what is meta-research, and meta-research is now an established field, a lot of us are active in this field. It didn't used to be like this before. And in this essay, Professor Ioannidis recounts how his early mentors always said, focus, focus, you have a problem, focus on the problem, but he found himself drifting from an argument to another. And he says, I don't think I have attention deficit and hyperactivity disorder, but just an pure unconstrained curiosity. And I think this is key to Professor Ioannidis' work and who he is as a person. No argument, no topic is under his radar of interest. It is absolutely incredible to see these breadths of interest, and you will see a bit on this now. He is one of the most cited scientists in the world, and these are not just words. This is not an exaggeration. His H-index that measures how many publications, the number of publications that were cited at least X times. So his H-index is about 260. This means at least 260 publications cited 260 times. We don't like indexes, but in a way we use indexes. His citation count is over 500K using Google Scholar, and so these numbers are really impressive and really hard to approach. He was trained in a multitude of disciplines. Few people know, in fact, I didn't know for a long time that Professor Ioannidis had a doctorate in biopathology and then was trained in infectious disease epidemiology, in infectious disease and internal medicine. Held multiple positions in Tufts and Johns Hopkins, NIH, also different places in Europe, member of the National Academy of Medicine, and also, perhaps, again, not very well known, author of fiction books, over 9 books, some that have won really literary prizes, some translated in English, if you're interested. So, a very, I would say, from all points of view, encyclopedic persona, and again, the person who created this field from scratch. Methods, contents, theories. If one day a book of meta-research, of the history of meta-research will be written, I think he will be featured in all chapters, basically. Also, as somebody who, after introduced the method, said, well, we have to look at the caveats of this method. Maybe there are limitations. Let's see if we can make it better. He defines science as a maze, and I like this concept as well, a maze of arguments, of data, of biases, but also of errors. So always keeping all these 4 things in mind and trying to approach the best solution. Last but not least, Professor Ioannidis is my most important mentor, I would say. Even if my time at Stanford was limited, it made a huge impact on my career and on my thinking. And I am very lucky to also call him a friend. So with this, I invite you to welcome Professor Ioannidis and listen to this talk.
Thank you, Ioanna. A million thanks for the very kind invitation, and thank you to all of you for being here today to discuss issues around reproducibility. Some disclosures to start with. No conflicts of interest to disclose, other than trying, struggling, failing, whatever you want to say, to be a scientist, which means that I'm struggling with bias all the time. I'm very opinionated. I have publish lots of biased papers, probably lots of wrong papers. Much of what I will show you today might be biased and wrong. So do watch out. Research needs to be supported. We see that a lot of research funding is cut in many countries. I think that's not a good idea. So we need to support research and science with heightened commitment. But most research to date has been non-reproducible, it has been non-transparent, it has been done with suboptimal research practices and designs. And we have a massive success story. We have more than 200 million publications. We have more than 7 million publications added every year. That sounds terrific, but the quality, and my voice cannot be heard there. Let me try to bring that closer. Okay. Is that better? Okay. Now, our reward systems are also aligned with these research practices, and our reward systems can be important because they can modify really what we get out of our effort. So can we get better? Is getting better just a utopia? Maybe we have reached an equilibrium that this is the best that we can do, and science does make progress. We do have discoveries, we do save lives in medicine and in other fields, but can we do better than that? Well, the question is who should do better, because science is not a single discipline. Along with my colleague Kevin Boyack, we're drawing maps of science, so this is a universe of science that includes about 500,000 different subdisciplines. Each dot in that map is one subdiscipline. Each one has its own scientific method. It's its way of understanding what a scientific method is. Where should we put more emphasis? Do we need replication, for example? How much replication do we need? How indispensable it is to share the data? Do we have statistics involved? What kind of statistics? What kind of data analysis? What type of perhaps artificial intelligence? But this is the bottom line, at least for biomedicine, looking over 30 years of publications from 1990 to 2020. This is text mining the entire PubMed open access publications, which is millions of papers over 30 years. The proportion of papers from each country that share their data, close to nothing. Although it has improved over time, over 30 years, it's pretty much close to very negligible. A utopia, what might it look like? Would we want it to be 100%? It cannot be 100% because there's lots of data sets that there's privacy considerations. You don't want to hurt people by sharing their data that people might be harmed if they become available. But at the same time, we want to maximize the availability of what we have. So then registered protocols, again, you see lots of darkness around the world. What would a utopia look like? How many of these 7 million publications do we want to see a protocol? I think if we see a protocol for 7 million publications, most of these protocols would be fake because most studies do not have protocols. And I would argue most studies should not have protocols because most studies are exploration. So I don't think that we should aim to have 7 million protocols because most research is exploration. And this means that a protocol cannot really be fully pre-specified. One has just to be honest that this is some work that it was exploration. It was iterative, and these are the steps that I took. Maybe I was lost in the forest. This is what I found. It looks very interesting. I arrived at finding a pyramid from an ancient civilization. Can you verify that you see the same pyramid again? Or that pyramid may be something completely different. Honesty, I think, is far more important than just fitting all the items in the checklist. What exactly did we do? How did we do it? Maybe we were lost in outer space. Maybe we had no clue what we were doing. I love the research where I have no clue what I'm doing, but one has to be honest that this is how we got there. What we do see in the literature is a predominance of statistically significant results. Another text mining exercise, we looked at the entire PubMed, all the millions of abstracts and all the papers that had been available in open access up to 2016. In the abstracts, whenever there were p-values, 96% of the time, they had statistically significant p-values. In the full text, pretty much the same thing. a decreasing trend from 98% in 1990 to 93% in 2015. We have repeated the exercise recently. It's down to about 92%. For some types of designs like clinical trials, it's even less than that. It's about 70, 75%. But still, most of the literature is comprised of statistically significant results. Is that bad? How would a utopia look like? Well, I think it would look much lower percentages than this, because it's unlikely that we're really so successful. So this is a composite of our success plus very heavy dose of selective reporting, that we just want to highlight what seems to be most interesting. And fortunately or unfortunately, interesting is equated with statistical significance to many or most people's mind. We can model the scientific ecosystem. We can create models of how science works, on how the scientific workforce operates, interacts, gets rewarded, gets expanded, it creates progeny, so that we can try to see what we would do if we were to modulate it and try to interfere with that. This is one such model that I built with David Grimes. It's a universe of scientists working on science. There's three groups. There's diligent scientists, there's careless scientists, and there's fraudulent scientists. And fraudulent scientists, until recently, I would say, are very rare, maybe 1%, but there's lots of suggestion that this is changing at the moment with AI and with fake papers and with paper mills. Currently, probably about 1 out of 7 papers is fake. That's what large-scale assessments of some publishers have shown. So, out of 7 million, maybe 1 million is fake, if that's expanded to what we face. Careless, how many people are careless? Surveys disagree depending on whether you ask. Are you careless? The answer is no. Are people in your immediate environment careless? Of course, yes. So I think all of us can be careless at times. Because of various reasons, sometimes well-intentioned, but we don't know what is the best methods to use. We don't understand that, that's not the right approach. But let's say that the majority of scientists are diligent, well-intentioned, they do a good job. There's some who are sloppy and very few who are fraudulent. And then we run the model through a number of iterations where we try to see if we reward people for what they produce, they create progeny, they create more people like them, and the model shows that after a number of funding and reward cycles, we will get the fraudulent and the sloppy overtake the diligent. There's no need for advanced math and differential equations to understand that. The fraudulent can get there with no work, the sloppy can get there with less work, so they have an evolutionary advantage. Now the question is, where are we now? Are we still in that starting condition where most scientists are diligent? Are we already in a situation where we have lost the game and most scientists are already careless and many are fraudulent? As I mentioned, we have far more fraudulent papers at the moment. It's hard to tell, but we can probe and try to see what is the landscape. Now, the landscape is changing very quickly as we speak. 10 years ago, there were very, very few journals that were publishing a large number of papers. Typically, they were journals like PLOS ONE and Scientific Reports by very respectable publishers. They were doing usually a good job in trying to peer review the papers. They were accepting many of them, but they said, I don't care about p-values, don't care about statistical significance. If you did some decent work, we will publish it. But now, publication is a very fruitful investment for companies, for entrepreneurs. It's a $35 billion market, has a profit margin of about 40%. There's very few things that will give you so much for your investment. So we have more and more journals that try to publish massively just for collecting fees from article processing fees. We have many mega journals at the moment. At the moment, about a quarter of the scientific literature is published in journals that publish more than 2,000 papers every year, every single year. Some of them publish more than 20,000 papers in a single year. The best journals in my field, like epidemiology, have typically published 100, 150, 200 papers every year. And now we have journals in epidemiology and public health that publish 18,000 papers in a single year. Another one published 7,000 papers every single year. So we are flooded with papers that are not necessarily fake. They're not predatory journal type of situations where everything gets accepted if you just pay a fee. But how do we handle that? The other factor that is changing the landscape is that scientists know where to go and what type of field to attack. It's not just bandwagon effect. Scientists have a good instinct. The average scientist is a very smart person. They would move to whatever field is hot and incentivize them. So during the COVID-19 pandemic, as we published in this analysis in PNAS, in 2020 and 2021, 98 of the 100 most cited papers across all science were on COVID-19. So it was not that I would not expect to see a lot of attention to COVID-19. So if you have one out of the top 100 papers across science, this means that you're in a very hot field. You really made the top news of science. If you have 2, 3, that's very exceptional. But 98 out of 100 is completely unheard of. We also saw that more than 2 million scientists published on COVID-19, more than 1 million papers within 4 years. And if you divide science into 174 fields, according to the Science Metrics classification, we had experts in all 174 fields publishing on COVID-19. Very quickly, the last field to fall to COVID-19, be infected, was automobile engineering. It was infected, it published on COVID-19, its experts, in fall of 2020. And it was not about how to build cars that would enhance social distancing. You know, some people hanging out from the window, others being in the trunk. It was automobile engineers doing epidemiology and virology. And of course, you can understand what the consequences of that were for the quality, the rigor, the credibility of that literature. So many of us have argued that we need a revolution. So we write manifestos, speak up, rise up, fight, whatever. I'm happy to see just evolution, step by step, incremental progress in the right direction, and trying to move from a situation where we have these millions of papers that are very questionable to a situation where we have some more papers that are credible, some more papers that are useful, some more papers that are reproducible, some more papers that I can put more trust on them. There's lots of opportunities to do this because science is not a one thing. It's not that I have to fix one step. There's multiple steps in the scientific process. Each one of them is susceptible to biases, to opportunities for errors. It is also susceptible to the possibility of preventing these errors, preventing these biases, doing something to enhance the credibility of that step and the composite that we get as we move from thinking about an idea, developing the hypotheses, designing the study, running the study, collecting the results, analyzing them, presenting them, publishing them, and then building a new wave of hypotheses. And all of that happens probably at the same time among multiple projects and multiple scientists and multiple teams that work in parallel. It's not just scientists who can improve these steps. It's also the funding agencies. It's also the journals or the publishers. Institutions can make a difference if they incentivize things that move in the right direction. The general public can help because they realize that science is so important for their lives. It can make their lives better, it can make their lives worse if things go wrong. So we need all of these players to be aligned to try to help improve the validity, the efficiency, the rigor of each one of these steps in the scientific process. Reproducibility is a word that sounds like a utopia on its own because everybody is praying to the God of reproducibility, but people mean very different things. Their God is very different. This is another text mining exercise that we looked across all major fields of science. Each one of them has been using the term reproducibility of results, or whatever, more frequently over time. But people mean very different things. These are the three main things that people have in mind when they talk about reproducibility. One is reproducibility of methods. Methods typically are this fine print, small font section that nobody cares about. But it's really the most important. I mean, this is the science. But it has to be there. You know, we have to write some method section. So being able to resurrect that method section, make it work, you know, make the code run. See what are the chemical ingredients and what are the processes. Go to your lab, a little bit of this, okay, and a little bit of that, 32 degrees, mix, explosion. You know, yes, wonderful, I got the explosion done. That is very uncommon to have. Reproducibility of results is, let's get another study. How many studies? 1, 2, 50, 100? You know, there's some topics where we have thousands of studies. There's others that we have none. But you want another study and you want to see that you get the same result as, or something compatible to what we saw in the first place. Reproducibility of inferences. I ask all of you about reading what you have seen in 1, 2, 10, 100 studies. What do you make out of that? Do you see a signal here? Oh, yes, I do. No, I don't. I see some signal under these circumstances. No, it's under these circumstances. How about guidelines? Would you use that if it were an intervention, like a psychological intervention or pharmacotherapy? People may have very different ideas about what to make, what kind of inferences, what kind of conclusions to make out of the same set of evidence. There's subjectivity unavoidably, even in the most quantitative, rigorously documented science. People may still disagree on what to make with it. Here's a stereotype. I'm not thinking of any special study, but this is a very common recipe of how things can go wrong. Research practices with small data. Most of us, most of the time, we work with small data. We wish to have the $1 million or euro grant that would allow us to get huge data sets, but usually we get small bits of money. We can only collect a little bit of data here and there. We work alone, solo, siloed investigators with a small team. We have to survive until the next funding cycle and make a case that we found something interesting. This means that one has to cherry pick the best looking results to make a case that I work on something important, something interesting, something significant. Much of that documentation will be post hoc. P-values of less than 0.05 would be enough. No registration, no data sharing because this is ammunition for the competitors, and no replication because this will just make me waste time and I may be just back to square zero if I cannot replicate whatever I arrived to as my main narrative. So this is a recipe that is very likely to lead to very misleading situations, and we see that across the board in practically most scientific fields, both in early discovery and let's say preclinical and translational and clinical and implementation and late research. The common denominator is a paper we published about 10 years ago looking at neuroscience of all stages from early discovery all the way to clinical and evidence-based and implementation. The common denominator was that the power of the studies was very low. The average power was about 20% with very conservative and probably optimistic assumptions. With realistic assumptions, the average power was about 8%. So really a very underpowered environment. Neuroscience shares with economics, which is very far apart in the universe of science, the fact that they have about the same average power in observational analysis, at least. Along with Tom Stanley and Christopher Liagos, we have accumulated all meta-analysis on economics topics, mostly observational economics. The typical power is very, very low, in the same range as what you see in neuroscience. We have another stereotype, another paradigm, recipe of big data. You know, many fields now are using very large data sets. Some of these data sets accumulate without having to do anything. You know, electronic health records, I'm not doing anything right now, but you know, if I go and check, there will be many thousands of patients who have been added to the electronic health records of whatever system I'm working with. Genomics, huge amounts of information. mobile technologies with personal information being collected. Right now, there's information being collected about me. Someone will analyze me in various ways. I hope they find something good about me, because they have to say something nice. Lots of that research is done, and more of that will be done, with extremely large sample sizes, extremely overpowered studies. This means everything is going to be statistically significant. Again, one needs to cherry pick to build a narrative. Again, much of that is done post hoc. There's more fancy statistics, but most of that is idiosyncratic, not really very standardized. People may be looking at very similar problems from a statistical perspective, but using very different statistical approaches to that. Most of that is not registered. And there is, in some fields, more data sharing, but very often there's no understanding on what exactly is being shared, because it is just a link, go there and you will find the data, but then you don't understand what exactly is happening and what these variables mean, and what are the caveats behind the data collection, and you come across some very logical query problems, like how can it be that these women have prostate cancer, and then you try to find the author, and the author says, I didn't collect the data. Well, who collected the data? Someone collected the data. I don't know. The data collected themselves. And then it's not easy to find out what has happened. So big data have big opportunities, but they also lead to big noise and big error. And I don't want to dismiss them, because I love them and I work with them and I'm addicted, but you have to be very, very careful, because the opportunities for error are probably exponentiated working with big data. Another complex situation is that evidence can be highly scattered, and it's not linear. It's not like we make one step and then we make another step in the same direction. Science moves in zillions of directions at the same time, and some of them are more productive and interesting and useful than others. Some phylogenetically evolve more than others, and others are more stagnant, probably. These are the geometries of the networks of treatment comparisons for neglected tropical diseases. Neglected tropical diseases affect billions of people, so they're very important. They cost a lot of lives and huge burdens of disease around the world, mostly in populations that are underprivileged, in low and middle income countries. And not sure how familiar you are with networks of comparisons of randomized trials. Basically, you see a link, it means that different interventions, which are nodes, are compared against each other. So one would have liked to see, well, we knew what was the best intervention, and then we developed a new one, and we compared it against the old one, and now we saw that it was better. Okay, and then we used that new best option, and we developed a new one, and we got another step forward. That would be kind of a linear process. There's nothing linear about these plots. It is very, very complex polygons and stars and connections that probably have some let's say, community rationality about it, but they also have a lot of irrationality on how they're run. For example, in that case, there's very little evidence comparing what would be the primary options according to, let's say, WHO. Very few people dare compare the top options against each other. They mostly compare each of the primary options against very different interventions for each one of them. Small data is a problem, big data is a problem. The worst problem is no data. And no data does not mean necessarily no data at all. So no data could mean two things. One is there's really no data. The second option is that, well, there's probably a lot of data, who knows? I don't even know, but I don't see any data. So there's no data situation. The classic example is Theranos, the highest valuation startup about 10 years ago. I wrote the first critical paper against Theranos at a time when their CEO was getting honorary doctorates and was at the board of Harvard Medical School, and was having the vice president, who's now president, visiting and saying that, this is the future of American science and medicine and healthcare disruption, and Time and Forbes and all the big newspapers writing that this is the new Steve Jobs and whatever. And I wrote a paper in JAMA that went through editorial, peer, and legal review before it could appear, saying that I don't know whether their valuation should be $9 billion or $9, and now their valuation is $0 and their CEO is in jail. In that case, they really had no data. They had published nothing, and they had published nothing because, good for them, they had nothing to publish. So they were honest, at least, about that, because others may have nothing, but they may still publish. That's not a single rotten apple. We have lots of companies, lots of people who are running very important of science transforming technology and society that just don't publish anything. We have seen that with Joanna running analysis of all the big companies, startup companies across health. About half of them publish nothing or very little, even though they may have valuations of several $1 billion worth of material for what they do. The second problem is having data, but not having that data in a space that I can see, I can understand, I can feel, I can touch, I can work with. And we see that a lot with the new wave of technology affecting science in large scale with artificial intelligence and large language models. We have currently a situation where many of these big tech companies have 100 times higher computational capacity compared to Stanford. Stanford has the highest computational capacity compared to any university, but Alphabet, Google, Meta, Facebook, Apple, Microsoft, their computational capacity is 100 times bigger. I don't know how much data they have, but in theory they can have 100, 1,000, a million, a billion, a quadrillion, whatever million fold more data than what is available for academic researchers to run. If that's the case, we're all becoming obsolete. Just go to Alphabet, go to Meta. Forget about me and University of Padua, 800 years, and Stanford. No, that's we can put a good resort here. I don't know. Do something useful. Academia would be dead if that's the case. That is also a scenario that can happen if the balance of power completely fails. I've said a lot of bad things about the industry, but the industry are also my heroes in some regards, because in the reproducibility crisis, they were the first to produce evidence that people started taking seriously. There were a bunch of us for many years since the 1990s saying, we have a problem, who cares about that? Academics, But the industry, 2012, 2013, started looking at papers that had been produced by creme de la creme universities like Harvard and Stanford. They were very highly cited, the most highly cited papers in the field. They were promising that they would deliver drug targets that the industry would use and produce blockbusters and make billions of money. That counts. Oh, no citations, who cares? But money, that counts. And they could not go anywhere. So they started publishing papers showing that most of that creme de la creme academic research could not be reproduced. The preclinical research could not be reproduced. Bayer investigators published that in 2011. Then Glenn Bigley with Amgen oncology drug target projects, informed by highly cited academic papers. Only 6 of the 53 could be reproduced, and concluded that the failure to win the war on cancer has been blamed on many factors, but recently a new culprit has emerged. Too many basic scientific discoveries are wrong. People thought, well, that's not reproducible because this is industry data and they do not share the data set. So they fail and they're just killing themselves, falling on their own short. But many years later, we have independent validation by completely independent, non-conflicted investigators. For example, we have the Reproducibility Project Cancer Biology that pretty much shows the same picture. The large majority of the most highly cited cancer biology research cannot be reproduced. And it's not that people try to reproduce, they run the experiments and they get different results. Yes, this is one part of the problem. The second part of the problem, which is even bigger, people cannot even start the experiments. So reading the methods and reaching out to the investigators and getting feedback from them and going back and forth for years, they cannot even start the experiment because many things are intangible. They're not shared, they're not understood. It's not possible even to start. So 193 experiments designed, but only 50 eventually completed. Now, those that were completed, they took on average 197 weeks from starting until getting the results peer-reviewed. So you can think of a PhD student who starts and they're introductory to their training. Why don't you repeat that experiment from Nature? And it takes them 197 weeks to manage to do that for 1 out of 4. And the other 3 out of 4, even 197 weeks will not get them anywhere, just to get their hands on experience to get started. People are not happy with this. So we get what we call the reproducibility wars. People think that their reputation is at stake. They feel that they're attacked, that there's a moral hazard. I think if we all accept that science is full of errors, is full of mistakes, we can all make errors. I always make errors and mistakes. I'm very happy when someone can tell me, here's an error. Oh, wonderful, we can fix that. That might be a more reasonable reaction. The second problem is that, well, we have so little funding for science. How much replication do you want to see? The Capella degli Scrovegni is unique. Are you going to replicate that? You cannot replicate that. But as you can see, there's already replication. You know, look at the ceiling. It's pretty much the same, right and left. And so, yes, that's a problem that we have to face. We have to decide how much to invest on that self-reflective process. This is from a paper that has been provisionally accepted by PNAS. We discuss both non-epistemic values and epistemic values in choosing what to replicate. So non-epistemic values are that you have a problem that if you get it wrong, you're going to harm people. So you want to mitigate harm. Or you want to make sure that you communicate with some level of certainty, especially if it's for lay audiences, and you don't want to get it wrong because otherwise you will just completely lose your credibility against the public. You will lose public trust. Or even just communicate to scientists about what we know and what we do not know. But there's also epistemic values, like maybe you are into theory development, you're into theory testing, you don't know exactly what does what, and you want to try different recipes. You don't want to exactly replicate, you just want to try different things and see what the composite is of that experience. There's many ways that we can do better. This is a list of things that can be done. Large-scale teamwork, collaboration, adoption of replication culture in the right dose, registration of studies, protocols, analysis codes, data sets, raw data, and results, sharing of all of that, reproducibility checks like the Cancer Biology Reproducibility Project, containment of conflicted sponsors and authors, more appropriate statistical methods, standardizing definitions and analysis, more stringent thresholds for claiming discoveries or successes, improvement of study design standards, improvements in peer review reporting and dissemination of research, and better training of the scientific workforce in methods and statistical literacy. A utopia, okay? But some of that has been done in some fields, and more of that probably can be done in more fields. For example, for sharing, people who work on genomics have agreed. There was about 70 authors that we co-authored that paper in Science, that anything that is publicly funded and it's genomic and there's no privacy issues, just put it out there. The data should be available immediately. Don't wait to publish every little chunk with just your name. Just get all the data together, give credit to people who generate the data, give credit to people who will have these data contributed to large-scale composite publications. What to do with past studies? As I showed you, most of the past studies do not have the raw data. Can we get these data unearthed? So along with Tom Hardwick, we have what we call this Data Arc project. We have targeted the 100 most highly cited papers in each scientific field. These are the results for psychology and psychiatry. We've done the same recently for all social sciences. And we asked investigators, please give us the data. We will curate them for free. We will make them available for free. Just give us whatever you have. We'll take care of it. We want no money. It's all our effort. Most did not do that. And some had already shared their data. A few more did share their data with us, and we curated them. Most could not. And the key reason was that the data sets were outside of the researcher's control. The principal investigator did not have the data. The principal investigator had not seen the data. The principal investigator could not even know whether the data existed or not. Just believe the contact from the company who sent the manuscript. We've run the analysis. We've written the manuscript. Take a look. Your name is on it. That's a bit scary. Journals are trying to improve things, so they have, for a number of years now, data sharing statements asking people, tell us how I can get the data. Not necessarily we want the data. BMJ and PLOS Medicine have asked for that for clinical trials. BMJ recently said, you have to share the data for everything that we publish. So we looked at JAMA, New England Journal of Medicine, and Lancet, 500 clinical trials. Many had data statements. Individual level data, about 50% being promised. In some specific repository, about 20%. De-identified individual level data in some repository, about less than 10%. I want the data right now, this evening, 2 out of 500 publications. You could get them right now. We repeated the exercise in JAMA Internal Medicine, in JAMA Network Open recently, looking at the 600 most cited clinical trials of all times. A little bit better, but still less than 5%, you can get the data right now, on the spot. John Carlisle, an editor of Anesthesia, has been asking people who send randomized trials to his journal that he wants to see the raw data, otherwise he will not consider the paper for publication. By looking at the data, he concluded that 30 to 40% of these trials are completely impossible, implausible, fake, zombie trials. That's how he called them. I wrote an editorial to describe his work, and it was published on a Halloween day, very appropriately so. I calculated that if what he saw in anesthesiology, anesthesia is one of the best journals in the field, applies to the rest of medicine, we have about 500,000 randomized trials that are zombies, and they're circulating among us, affecting systematic reviews, guidelines, policy, medical practice, science, everything. Conversely, PLOS Medicine and BMJ have the policy that if you publish a trial with us, you need to promise that you will make the data available. So Florian Odette and other people from our team wrote to these authors, we want the data, we will reanalyze them to see if we get the same results. About half of them, 46%, send their data sets, we reanalyze them, we got the same results. They are very, very minor deviations, probably due to rounding. So we can trust that a trial published there probably does have very valid results. And there is more data sharing happening. We have an observatory that maps random samples of the biomedical literature. We have seen an increase from 0% to about 20% over the years. It has stabilized at about 20% in the last 5 to 7 years. There's like a hard ceiling, I think, that we have reached. Code sharing is not that common. It's about 5%. Protocol registration at about 7%. We have far more placeholders, at least for conflicts of interest and for funding. We don't know whether the disclosures are complete, but at least someone is asking for them. And we have more people who admit that what they do is a replication. So we've seen some improvement. The improvement is not the same across different fields. These are the same maps with color on where these research practices are happening. Some fields are sharing data more than others. A subset of them are also sharing code. Some fields are sharing protocols, but these are typically not the ones that share the data or the code, so having all three is pretty uncommon. And you have disclosures, but as I said, you don't know whether these are complete. There's also vast heterogeneity across journals. Some journals, most of the papers that they publish have sharing practices. Some others have never shared anything among the work that they publish. With more complex methods of computational approaches to science, I think we need more transparency. Many years ago, we published some guidelines in science on how to enhance computational reproducibility. And if you have more complex models, you need more effort to make those transparent. But I would argue that even for the most complex type of research, like artificial deep neural networks, there are resources, there are tools that can make them fully transparent. This is a paper we published in Science, in Nature a couple of years ago, and we show how you can do that. Once you start using these tools, it can become very easy and very straightforward. I will close with a couple of slides about the reward system. The reward system is what drives our research practices. If we ask for something, and we say this is how you will be rewarded, get funded, get recruited, get promoted, get tenured, probably people will do that. Scientists are smart people, they will try to do more of that. If we tell them we want you to publish more, they will publish more. And this is what we mostly tell them, or we tell them we want you to get more money. They will try to get more money. So we reward productivity, but we need to find ways to reward also quality, reproducibility, sharing, and translational impact, or a PQRST kind of electrocardiogram to have a more complete sense of what matters. And there are ways that this can be done. It is not, clearly it is not impossible. These are things that can be measured, they're tangible, they can make a difference. Each one of them needs to be placed into context. None of them is like a perfect outcome. These are mostly surrogates of how we do science, but I think if we really want them to happen, we can reward them for happening. Do universities have faculty handbooks that ask for these extra features? In an analysis that we did looking at 92 universities around the world, we saw that no, that is not the case. But most of the faculty handbooks are really outdated. Maybe they're revised every 40 years or who knows. In the real life, I think I have seen substantial progress when people discuss about how do we reward people, how do we recruit new faculty, how do we promote, that more of these other issues become more relevant and more frequently discussed. Eventually, our reputations are based on getting it right rather than being right. I'm sure that I'm wrong most of the time, but hopefully, iteratively, as evidence accumulates, we can correct mistakes and errors and inaccuracies and biases and arrive at better estimates. And as I said, it's not just scientists, it is many other stakeholders who could make a difference in the process. There's industry, which includes a sales and marketing component besides their R&D. There's private investors, public funders, some of them open, others closed like the military, not-for-profit funders, philanthropists, journal editors, for-profit publishers, professional scientific societies, universities, not-for-profit research institutions supporting non-scientific staff, hospitals, other professional facilities offering services related to science, other financial entities like insurance companies, governments, state, federal authorities, and consumers, people, the average citizen. These entities are interested in different things. Some want to see things published. Others want to get funding. Others want to see things translated, that something works and it saves lives or improves people's lives. And some want to make profit. There's nothing wrong with any of these motives provided that they're synchronized and eventually we get something that is reliable and it is really useful for society and for humans. To conclude, lots of negative statements, but this doesn't mean that we should not respect science and not invest more in research, especially high quality, reproducible, open, transparent research, and try to align our incentives with that goal. Where a utopia should be, I don't know. You know, as I said, we're not asking for 100% on these indicators because it is impossible, but many of our indicators can probably be improved. There are many possible interventions to do this, and I think that many of them have to deal with transparency, with openness, with sharing. The details, though, can make a difference. So I'm not going to endorse interventions just because they sound nice, just because someone says open science. Open science sounds wonderful, but someone may mean open science, pay a higher article processing fee, and that's all I care about. That's not the same as open science for the benefit of science and humanity. Finally, I'm biased to believe that we do need a self-reflective process of research on research, because we can understand where we are and where we're heading and how far we are from different utopias and whether some utopias actually might be nightmares. I think meta-research should be held to the same standards of scrutiny, transparency, openness, sharing as other scientific fields. So maybe everything that I told you today is wrong, and please find out about that. Thank you very much.